So top 3 questions with Dr. Raj Arora. Thanks for joining us.
You're welcome.
Amazing. So designing a space is a deeply personal journey. What is it like working with Margaret on your project? And were there any standout moments or design choices that truly resonated with you?
Okay, so working with Margaret, honestly, has been an exhilarating experience, I will say. Not only are you super fun to work with, you're serious when you need to be, you're somebody who understands the concept from the get-go. I think we're a tough family to work with, I would say. We're quite picky.
That's understated, isn't it?
I think so. But I think for me, this is my first project. So,
Absolutely.
It was separate to the hotels. It's my little baby.
Yes.
And so I think I was even more picky about everything to do with it. And I think you really, put my mind at ease. You were somebody who I could come to it. Honestly, I think I was WhatsApping you at random hours at night with ideas.
I remember.
And you might not respond straight away, but you'd always be like, got it, or tick, or you'd always make me feel like I've got this. And so one of the standout moments for me was the emerald room, the mirror. So my rooms are named after rough diamonds, and in this particular room it looked beautiful, but there was something missing. Yeah. And I remember saying to you, Marge, I need something in this room, and you said, let's put a mirror in. I think we got delivery for a mirror, but it wasn't the correct mirror, and we were weeks from opening, and I remember just saying, Margaret, I need something emerald in this room. Yeah. And the mirror that you brought in, I think within like a couple of weeks, it just arrived, it was perfect, it fit the wall perfectly. Yeah. And I just remember taking that sigh of relief and thinking, she really gets it.
Thank you.
And you've been there to handhold through it all. You give your ideas, but you know when not to, and when to say, okay, this is yours. Like I said, with the fabric and the material, the wallpaper, you brought the warmth in, the colour scheming you helped with, and the quotes are really important to me.
Yeah,
I think you made that happen. The tree was a big part of the clinic. It's all my patients that come in talk about the tree, and the idea behind that was that we are in a beautiful retreat here, and I wanted the clinic's in the basement, but I wanted to bring something into the clinic that almost resonates with the rest of the hotel, so we're not completely,
detached away from everything.
And I think I remember saying this to you, and you said, "What about a tree?" And I thought, tree? Is she going to bring a tree into the clinic? But actually, you create this amazing tree with words on it, and the whole clinic is about words, because I feel like in medicine, in aesthetic medicine and general practice and every other kind of medicine, communication is key, and sometimes patients find it hard to communicate, but if you see words that are reassuring, it almost makes you feel like the space is somewhere that you are safe in. And you really allowed me to bring that in. You took my vision and you kind of made it your own, and then let me kind of complain about things if I wanted to, or be happy about things, ecstatic if I wanted to.
Having a little joke.
And you just kind of, I mean, even till now, the project's long, you'll come in and say, oh, is everything okay? You always ask, and that kind of follow-up, I think, is second to none.
Yeah, thank you.
Designing your clinics and wellness spaces, what elements do you prioritise to create an environment that enhances both patient experience and their overall well-being?
I think, like I said before, so having been a patient and going through a very difficult journey, I went from seeing everything from a doctor's perspective. And obviously, as a doctor, you are trying to understand the patient's perspective, but it's difficult at times. You're not in that diagnosis, you're not in that space. And oftentimes you're fit and well, and the patient's unwell, and you're almost trying to, impart this advice to them. But I think each space has to tell a story, and for me, the clinic Face Bible really does do that well.
Absolutely, and I think that's exactly it. I think where you did give the brief and you spoke about all these sort of things, we definitely, and all the textures that we used, even texture in the wallpaper or various, signage that we did for you and so on. It just elevates everything and really brings that sort of comfort, but that safety, that hold for each of your clients that come in, and it brings in that warmth because it gives all those different layers like we did. True, and then there's also all the regulations that we have to keep to. So there are restrictions that you do, you can't just whack fabric on a clinical wall, but we managed to, I think, look at all the obstacles and then really bring a really soft, sweet space together.
I think the fact that the rooms was, are CQC compliant, which means that we have to be regulated, meant that certain floors had to be a certain way, but you brought that in, my brief came into that the whole way through, and I think the wallpaper was very interesting because that came from a very personal experience of being in a clinical setting as a patient where the walls were white.
Yes, and everything was white.
Every day that I spent in these white walls, I just felt like, I felt low. It wasn't very inviting. It wasn't very warm. And the first thing I wanted my patients to feel, because it's a private GP clinic, is when they walk in, no matter how ill they might be feeling or unsure or whatever it is, anxious, when they walk in, they feel warmth. And I feel like that wallpaper really brings that homely feel to the clinic. And that was your idea, so thank you.
Pleasure. And it's even actually like with the words as you go down the corridors and the words in your treatment rooms and so on, it brings that sense of, like you say, that tranquil peace. So when somebody does lay down or sits down, you know, to have a consultation with you or have a treatment, they do immediately, like you said, you're almost taken to another sort of space. So you are calm, and then you've obviously got a wonderful approach with people anyways, genuinely. So it's fantastic how I think, it all really does just work together, and it fits together while you still have your clinical space like you need.
I think
so it's very practical as well.
Yes, one of the great things about the clinic was the walkway to the clinic. So I put these quotes up, and this was designed pre-COVID.
Yes,
so what's really interesting is that we had this idea and concept.
Yes, we did.
Before prevention became a thing, and now we know the fitness and wellness industry has boomed post-COVID.
Absolutely.
But actually these ideas and concepts were in place beforehand. So the idea, you know, we've got prevention is better than cure on the wall. We've got all these different sort of uplifting, motivational health quotes on the wall, and they were there before COVID. And then to go through that whole time, you know, and people have come out the other side much more conscious about their health has really served, I think, the clinic has served well in that way, because actually it does talk to its patients, and we were almost forward thinking like that. And that again, you know, I remember saying to you, I want to put the things on the wall, and what I loved was that you never said to me, oh, that's not been done before, we can't do that. You always worked with my ideas and pushed them forward in a way that would work. I don't understand interiors, you know, I don't know how that works. So for you to say, actually, if we do it in this material and put it on the wall, it will last longer, it will be more effective. So it was really helpful to have that, because I really put part of my soul into that.
You did.
Think you curated it for me, and every time I walk down that walkway, I have a feel nostalgia, so much feeling and emotion into it, and it makes me more, I think, in tune to doing an even better role as a doctor in there. So yeah, I love it.
Oh, that's amazing. Thank you. That's such a wonderful thing to say. That's really touching. Thank you. And I agree. And that means that I've done a job well done, to be honest. And I'm so pleased. And hopefully your clients feel the same when they go in there, because that's what we want to achieve at the end of the day. It's not just creating a space so that, like you said, it's a pretty space for people to come and visit. It really is the journey. It's the experience. It's everything involved that needs to come together to have a good experience when they're with you. Thank you, darling.
What has been your defining moments as you got to where you are today?
Well, that's very kind, thank you. I think one of the most defining moments for me was probably on my journey as an NHS doctor. So, you know, we all know the NHS is overwhelmed, and as a working junior, I found it really difficult to have any kind of autonomy over the kind of clinics I was running or the kind of departments I wanted to work in. So you're kind of almost providing service, and you have to follow whatever's given to you. There's issues with rota often. It's really, really difficult to even get time off, to the point that I remember trying to get time off for my wedding, and it was difficult to actually, you know, put that request through. So I realised quite quickly early on that I loved my work in the NHS, that it wasn't serving me as an individual, and that I wanted more from my career per se. So training to be a surgeon and then leaving that because of ill health and physical burnout in the NHS meant that I had to take less than full time, which, if anyone who knows me, I'm not a less than full time kind of girlie. You know, I like to work hard and smart.
Absolutely.
And I think I overdid it. Out of no choice of my own, the NHS was a busy place to work as a junior. It still is, and that was a tricky time for me. But what it made me realise when I had to take some time out and slow down was a lot of positive came out of that. It meant that I wanted to expand my career in different ways. I wanted to educate, I wanted to do more media work, and I wanted to create a space that allowed me to see my patients on my own sort of accord, like at the timing that I wanted to, which meant that private work was important alongside my NHS work. But the space for me was important. Where do I carry this out? What kind of field do I want? Having come out of ill health myself, I wanted a space that was luxurious but welcoming, but still clinical. It's still a clinic. And that's kind of where the Face Bible started, with its private GP health services and all the other things that we offer.
Thanks. Stunning. It's a great journey, isn't it?
It is.
Honestly.
Very, very nice journey.
And I think, can I just say something? Is, I mean, this doesn't have to go into the thingy, but, you know, I think a lot of people don't realise how, you know, what sort of journeys people actually take to get to the point that they are. They see, you know, a bit more of the glitz and the glamour, but your journey has been one of a lot of lessons and, like you say, a lot of actual experiences that have happened to yourself, whether good or bad, and it's taught you those things in order to get to where you are. So it is like building, you know, in interiors and architecture, it's building all those foundations to be able to create those strong walls to really get to where you are.
And on that point, I will say that oftentimes people say to me, like you just asked me as well earlier, how long did it take me to get to X, Y, Z? And, you know, I say it's a 10-year overnight success. So basically you keep working and working, and before you know it, somebody else is defining that success for you. They might say, oh, but you're really successful, and you're still looking at it from a you know, really junior point of view. You know,
absolutely.
And,
You've forgotten to look up.
Achieved anything yet, you know? So I think you've got to look back, appreciate your journey, and always, use that to motivate yourself going forward. And I don't think I'm successful, which is really weird. A lot of people say to me, but you've got a really good clinic, you know, you're on TV, you do lots of media work, you're teaching, you're a mum. How do you do it all? But the bottom line to me is success is different to everybody, and that's a really important thing. I think once you reach what success means to you, that's when I think you start to feel a little bit more successful.